Preimplantation genetic testing or PGT for embryos. Preimplantation genetic testing is a cutting-edge process of obtaining cells from embryos formed in the in vitro fertilization cycle or IVF cycle for screening for chromosomal disorders and single gene disorders. This test is recommended in addition to the standard IVF cycle before embryo transfer to further reduce the chances of any genetic diseases in the future prior to pregnancy. Invasive intervention or biopsy procedures are both safe and common in clinical practice by trained personnel and investment in specific equipment. Non-invasive PGT is a new sampling method based on a collection of fluid from embryos or the culture medium to obtain cell-free DNA to determine the genetic state of preimplantation embryos without the need for an embryo biopsy. PGT-A is a test that examines embryo cells to see if they have the proper number of chromosomes. PGT-M looks for specific gene mutations that are known to exist in one or both of the parents. PGT-SR examines embryos from patients who have a known chromosomal structural abnormality such as an inversion or translocation. PGT is recommended in patients undergoing IVF who are older than age 35 or have experienced repeated consecutive miscarriages previously. PGT is done on couples with a history of failed IVF procedures, with fresh or frozen embryo transfers, couples with severe male factor infertility in the male partner, or genetic disorders carried by one or more parents. It is also done when the female partner is diagnosed with unexplained infertility or the couple had a previous pregnancy with an abnormal number of chromosomes. PGT aims to achieve higher chances of a successful IVF cycle, reduced miscarriages, reduced likelihood of conceiving a child with a genetic disease or multiple births. PGT also increases the chance of pregnancy in couples with recurrent pregnancy loss, repeated IVF failures, or advanced maternal age. As a part of in vitro fertilization, the doctor retrieves a number of mature eggs which are then fertilized with sperm in the lab to form an embryo and later implanted into the woman's uterus. But there is another step before embryo implantation when a PGT is recommended in the IVF cycle. The embryologists take a small sample of the embryo cells during the development stage for a series of chromosomal defects. This test may take up to a week for results to come back. PGT identifies possible abnormalities in the embryos tested that could affect the success of the pregnancy or the development of the baby. The test identified healthy embryos without identified chromosomal defects that were chosen to be implanted into the uterus after the testing. There are several myths related to PGT, such as low-grade embryos have chromosomal abnormalities and that PGT is only recommended to older women or to screen for Down syndrome. There is a misconception that PGT ensures a healthy baby and can be used to create designed babies. Word of caution: PGT can only screen for some diseases and disorders and cannot predict if the embryos are going to be fully healthy. While PGT can be used as a screening tool, long-term safety studies are not yet available and therefore universal application of the PGT is not recommended by the Indian government. As per the Assisted Reproductive Technology Regulation Act 2021 for the regulation and supervision of the assisted reproductive technology clinics, the preimplantation genetic testing shall be used to screen the human embryo for known, pre-existing, heritable or genetic diseases only.